Top of the morning, Dan and Amy. President Trump mentioning in his briefing yesterday in conversations with New York City Mayor Bill de Blasio. De Blasio wasn't asking for ventilators or masks. He was asking for medical professionals. Shortage of medical professionals in New York City as they deal with the largest outbreak of the virus in the country.
And Laura Lightfoot did the same yesterday, saying if you're retired, we want you to get back into the pool. We need you right now.
Trying to put it in perspective for non-medical professionals like ourselves. I thought this piece by Dr. Paul Dorenwend, who is the Assistant Chief of Emergency Medicine at Kaiser Permanente in San Diego. It was in the Wall Street Journal yesterday. Nurses are the heroes of are the coronavirus heroes. How critical are nurses to the capacity of the health system? The number of nurses staffing the hospital determines its capacity. An absence because of a sick call or child care closes 3 beds. Understaffed floor beds result in boarding in the emergency department, and that creates a waiting room backup, for example. But just putting that in perspective, one nurse being absent for whatever reason can close 3 beds. Since we're talking so much about non-human infrastructure in the healthcare system, we lose sight of the importance of the human infrastructure a little bit, just in terms of trying to translate how important particular staffing is to the ability to treat these patients. And he explains in more detail, which I'm sure our next guest can as well, but from the doctor's perspective, it's nice, sort of the professional courtesy. If you wonder who actually sticks and swabs into the noses of worried patients, it's the nurses. They're on the front line, face-to-face, in the 6-foot danger zone. They're collecting the data that the epidemiologists use to track the outbreak. Moving in and out of negative pressure rooms, putting protective equipment on and taking it off. Nurses are caring for elderly patients who are severely ill and sometimes crashing. The nurses marinate in risk as they spend the greatest amount of time with the patient. They draw blood, obtain samples, provide oxygen, and steadfastly tend to their patients' needs. They are by the doctor's side as we intubate patients struggling to breathe. Once that patient is transferred to the intensive care unit, it's the nurses who do the mundane and the heroic to make sure the patient survives the illness or dies more comfortably.
And they're also there, too, because loved ones, this is a horrible part about this disease. Loved ones can't be with you in the hospital. And what a lot of them have been doing is making sure that they have FaceTime, that they can say goodbye to their mom or dad or their brother or their sister before they transition. That's so important.
For more perspective on this, we're pleased to be joined by Molly Erickson. She's a registered nurse. She's also the Director of Advanced Practice Providers at Rush University Medical Center. Molly, thanks for joining us. Appreciate it.
Good morning. Thank you so much for having me.
And thank you for what you do. I feel compelled to thank you after that wonderful op-ed by the doctor from San Diego. And the interesting thing about this is we talked about this before, as I'm sure you have within your professional circles. We had a nursing shortage for our healthcare system prior to the pandemic. So it must be that much more acute now.
Here at Rush, we have a tremendous nursing workforce, and we've been able to mobilize nurses across our healthcare system to really meet the needs of our patients. And we have with our command center, continuous staffing office that's assessing our staffing needs. And we've been able to mobilize our nurses to really ensure that our patients are getting the highest quality of care.
So you don't have a shortage of nurses there at Rush?
Not currently, no. Our nursing workforce has done tremendously. They are meeting the needs of our patients every day on the front lines. And we've been able to, through very strategic efforts, such as canceling elective surgeries and procedures, condensing our outpatient clinics, been able to really mobilize our workforce to meet the needs of COVID patients during this pandemic.
Meet the need of COVID patients as well as non-COVID patients. People
Correct.
Who need chemo and stuff still are getting chemo and stuff.
And there's been some very novel and tremendous efforts that have occurred here at Rush. For instance, we have a large virtual visits platform, which allows patients to get both on-demand and scheduled virtual visits, either video or e-visits, which allows them to stay in the safety of their home, not exposing themselves or others. We also have been able to do a forward triage in our emergency department that I'm sure you've heard about, that's allowed us to separate patients with influenza-like illness from other healthy, or the worried well is what we like to refer to them as. So we really have been able to continue to meet the needs of our patient population and continue to be prepared for this really evolving pandemic and trying to stay in front of what our patients need.
Well, yesterday, Governor Pritzker, he announced some good news, which I didn't see anywhere else, but 68% of our ventilators are available right now collectively across the state, and 41% ICU beds are still empty. That's a good sign, right?
The early data is very promising. The pace at which we thought the demand for ventilators was going to be, and the pace of spread of this virus, the early data is showing that the mitigation efforts such as washing your hands, social distancing, and sheltering in place have really been successful. Yes, we are continuing to see an increased number of cases, but the rate at those cases is not what was anticipated, and the demand for the ventilators is not what was anticipated.
I'm sorry to interrupt. Go ahead.
That's okay.
Just on that score, what about the rate of hospitalization? Has that changed at all?
We're seeing actually a decreased number of patients in our emergency room, which I think really reflects the appropriate utilization of the healthcare system and patients, successfully doing the mitigation techniques. We've met the capacity of our intensive care unit, but we were able to expand our intensive care footprint, so open additional ICUs and increase our capacity. So at present here at Rush, we do have ventilator and ICU capacity that hasn't been met yet.
What about the fear of passing the virus on to family members? I know you see scenes and hear stories about, doctors and nurses in California who have, made tents in front of their house because they don't want to, be associated with their family during this time. Lori Lightfoot yesterday, our mayor, opened up 274 hotel rooms to first responders, nurses, and surgeons. Is there a concern for that every day?
I think it's always a worry. Working in healthcare, you always, you have a passion and a love for your profession and also a love for your family. And so we continuously work with our healthcare providers to ensure their safety. We do have more than adequate PPE here at Rush, and those efforts such as alternative housing is something that we've explored with our employees and are available to them, and I think really provides that reassurance. The other thing that we have been very mindful of and I think has provided great confidence amongst our staff here at Rush is really having a leadership presence on the unit and communicating in this ever-changing environment. The recommendations of the CDC and change sometimes hourly, and so really making sure they have the most up-to-date information I think is essential to their comfort and their confidence in the healthcare that we're delivering.
How are you all communicating with other hospitals in Chicago and in the suburbs to make sure that the resources available are being maximized?
It really is a group effort. I'll tell you, it's a united front. We're communicating with them daily. We have a hospital incident command center here at Rush, and members of our hospital incident command center have daily communications with the hospitals in the area and nationally. In addition to that, at Rush, we're an enterprise and have Rush Oak Park and Rush Copley as part of our healthcare system, and we communicate with them regarding our practices and are definitely sharing information with other institutions because it's a united front to ensure that we're meeting the evolving needs of these patients.
So what is the most salient challenge for you and maybe for the system? I assume they're one and the same at present.
I think one of the greatest challenges is the rate at which the information changes. This is really an evolving pandemic, and as we learn more about the virus, the recommendations change, and making sure that we are communicating those in a clear and efficient manner to the front lines and ensuring that they have the most up-to-date information. And we've been able to work with our communications team here and develop different strategies for communication to ensure that they're being communicated clearly.
How many COVID patients are you treating currently at Rush? And how many are in ICU?
So that's obviously an evolving number. We have several hundred positive COVID patients across our healthcare system. Those are both in the inpatient and outpatient setting. And like I mentioned earlier, I can reassure you that we have additional ICU capacity and ventilator capacity for COVID patients. And we've successfully had patients who have improved with COVID and returned to a state of good health, which is also very encouraging and promising.
What about any of your nurses? Have they been infected with COVID-19?
We have one of the things that we're seeing here in this time of the pandemic is that, just like community can acquire COVID-19 from each other, so can healthcare workers in the sense of that they are out in the community. And so we have had cases of community-acquired COVID-19 amongst our employees, and that's something that we are, monitoring truthfully hourly. All of our employees are doing self-monitoring at home of temperature and symptoms. In addition to that, we have developed thermal monitoring here at Rush, where both visitors and employees go through a thermal monitoring scan upon entering the medical center to ensure an extra layer of safety and security.
I don't know how intimately you're involved in the testing piece of this. Certainly your nurses are. But one of the things that Governor Pritzker has said is, we're capped at 250 tests a day. There have been other states that have sought relief from that cap so they could test more people if they have additional capacity. And it seems like with the number of tests from Abbott and so forth being distributed and the better thorough throughputs, that more tests can be analyzed than maybe were the case 4 weeks ago. I just wonder if we're maximizing the testing capacity that we have or seeking relief from federal government mandates to the extent we need to in order to do that.
I've actually been quite intimately involved in the testing here at Rush. I helped stand up a drive-through testing option as well as a outpatient controlled entry clinic option. And I'm happy to say that we have a variety of avenues of testing patients for COVID-19 here at Rush, and have been able to not only meet the needs of our patients within our healthcare system, but partner with other institutions to ensure that their testing capabilities increase their capacity to test patients at their institutions as well. And so I think that that's something that, as this pandemic has evolved, we've been able to increase our capacity to test. And at present, we do have the capacity to test all the patients amongst our health system that are in need.
But I mean, are you bumping up against that 250 cap? Is that an issue for people in Chicago?
I think the 250 cap is probably in relation to the Illinois Department of Public Health testing sites.
Yeah, with the Illinois National Guard.
Right. So that might be their capacity at their sites for the Illinois Department of Public Health, but we have both internal testing capabilities as well as external testing capabilities.
Right.
So our ability to test is much greater, and our hospital incident command that meets really 24/7, but we have formal meetings several times a day. Part of that is our infectious disease team, and we have daily updates on their testing capacity, and that has been successfully expanding, which is wonderful. And like I said, at present, we have the capacity to test all the patients that are in need here across our health system, and have also been able to partner with all their healthcare systems in the Chicagoland area to ensure that they're able to meet their testing needs. So I think that was initially, on the onset of this pandemic, a large concern, and I think that the healthcare system has really been able to rise to meet that testing concern.
Amy Anderson, who's also an RN, she's also a nursing professor at North Texas University. She has some recommendations as well. One of the things she says is medical professionals need to be able to work without fear of retaliation or personal liability. State officials should revise their medical liability laws accordingly. She also talks about workers' comp and even hazard pay for those in high-risk units. Is that the liability piece or the pay piece? Is that anything that's been discussed at Rush as well?
I think one of the sorry that I start to lose track of the days just because it's been such,
yeah, no, understood.
We're a little over a month into this process, so it's a marathon, not a sprint, as I like to say. But I think it was 2 days ago that some very important legislation with regards to healthcare was passed by President Trump. And for instance, one of the things that it allowed is for CRNAs, gave them greater scope of practice and not the necessity for restrictive oversight by a physician. And I think legislation like that is extremely important in this time to allow healthcare providers to really practice to their full scope and training and to meet the evolving needs of our patients. And so I think that that there is more peace about that within our institution and nationally as we receive the support of both, our institutions and the government.
She is Molly Erickson. She's a registered nurse. She's also the director of advanced practice providers at Rush University Medical Center here in Chicago. Molly, thanks so much for joining us. Good luck to you. Stay safe, and tell your folks to stay safe as well.
Thank you. We really appreciate the time this morning. Continue to wash your hands and practice social distancing, please.
I am.
No
so
problem.
is Dan.
Yeah.
Thank you, Molly. And she joined us on our turnkey.pro answer line.
If you're talking about it, Dan and Amy are talking about it. It's Chicago's Morning Answer on AM 560. The Answer.
If your family depends on your income and something happened to you, what would happen to them? You need life insurance, and SelectQuote can help you get it at a price you can afford.